Well, welcome everyone. Hello, my name is Julian. I'm Julian Hartley, Chief Executive. It's great to welcome you to Friday's Report Out. I'm delighted that we've got a report out on our Paper Lite project, which I know has been going from strength to strength and really building momentum. And it's great we've got Karen here, Karen Mitchell from the Medical Records team, to report out on where we're up to with the project. I can see you there, Karen. Welcome. Without further ado, Karen, I'll hand over to you. Thank you very much.
I think first Guy's going to take it.
Excellent. Oh yes, I didn't spot you there, Guy. Hi, Guy.
Hi, Julian. Good afternoon, everybody. Thank you for having us. Yeah, very excited to be here today. I'm just going to say a few words to set the scene before handing over to Karen. So Paper Lite, this has been for us quite a significant project because it reaches out across every clinical service in the trust. And just to set the scene or provide the order of magnitude, there's some statistics on the screen there, but safe to say the team have scanned over 20 million images now since beginning back in 2015. But that means they've fed 10 million documents through the scanners, documents in one form or another. It's been a huge undertaking. And just to help people understand what that means, that's 20,000 reams or 4,000 A4 copy paper. Or, in other words, 50 tons of paper has now been scanned. And I'd emphasise that this brings an array of benefits for us for the trust, predominantly quality, the clinical experience, enriching PPM as a single source of patient clinical information for them. It supports the trust's recognised strategy of developing and enriching PPM as our EPR of choice. And there's benefits around infection prevention and control, estates, financial benefits, not having to pay for so much paper and folders, not having to pay for boxes of paper to be transported around the city. And there's probably an environmental benefit there too. So that's just to set the scene and provide an order of magnitude. So without any more further ado, I'll hand over to Karen. Thanks, Karen.
Thanks, Guy. Okay, so first, on behalf of my team, I would like to thank you very much for giving us the opportunity to speak to you today about what we have done in the Health Service Department over the last 12 months. The health record is an essential element of patient care, using primarily by medical and nursing staff to document each episode of care. The record provides a channel of communication between different professional groups within the hospital and also with the wider community. So it's a very important part of the business. So for background, we've just kind of gone a little bit as to how we operated from a paper perspective. So from April 2019 to March 2020, we provided the following paper service, just so that we can put in context as to how the service has changed. So the outpatient clinic had 386,000, email requests 190,000, acute team 56,000. So the total number of requests for paper health records was 632,000 from this period. And the total number of health records which were returned and filed in the library is 716,000. So significant amounts. Next slide, please. So if we go through kind of the problems and the challenges that the department faced when the COVID pandemic outbreak started, obviously our task was to go paperless. It was the questions like, what do we scan? Is it urgent case note requests? Do we have the equipment to scan in-house? The COVID wards messengers, is it safe for them? Can they still go there? Your staffing, with everybody not being able to come in, because unfortunately with medical records, most of the work has to be done at the hospital. It can't be done from home. Social distancing to make sure that we have the right enough space to do the 2 meters, and the unexpected adaptations to changes in working practice. The library was a very physical place, pulling documents, lots of trolleys going backwards and forwards, to sitting all day doing preparation work. So it's been a massive change for the people to adapt to. And that's been one of the biggest challenges because they weren't used to doing that. Next slide, please. Lights. So that you can release the resource in the space due to the reduction in the management of the paper record and space required in-house. This benefits most of the departments, clinicians, nursing, AHPs. And how do we do it? We no longer had a requirement for a file paper into the health records. The reduction in movement of records around the trust, and you know, when you actually do the process flow of how many places that paper goes, it's significant. No longer a requirement to locate, prepare records for clinic admission, and the clinical information available at point of entry. And obviously it's very green way of working. Next slide, please. So these are photographs that were taken. So the library pre-2020, you can see absolutely full to the maximum, can barely move in there. To the progress mid-20, those boxes are storage boxes that are on their way to the restore facility for storage. To the currently, if you can see, it's a much better working environment, lots more space. We can now space people out and make sure that it's, you know, there's enough distancing in what needs to be done. It is still, the Clarendon wing is still active. It's a closed library, but we do still have people doing their prep and scanning work there. Okay, next slide, please. So what actions did the team take to resolve the problem and the challenges that we faced? So pediatric records were obviously very important. They were culled and scanned from Clarendon Library with the exception of the complex services such as oncology and cardiology. The adult records in St. James's Library that could be scanned from planning admissions, the waiting lists and for outpatient appointments, it was to try and be proactive. And then obviously the urgent requests for paper records, we've been scanning on demand. Next slide, please. So also we picked up from wards and outpatient clinics, the paperwork for discharged patients is to be scanned and available to view within a 24 to 48 hour time period on PPM Plus. This is quite a challenge to do, but it's been working really well. We work very closely with the Gateway Bureau and obviously the COVID funding helped us to outsource scanning services. Working with Restore, outsourcing of the storing of the records, and the Data House Warehouse team, they couldn't have done it without them because they did the lists which enabled them to cull the records and make sure we chose the right ones. Next slide, please. So the actions for phase one, the major initial cull in the library that was sent to the Bureau between April and July, they did 52,000 pediatric records, and these were prioritized because children cannot speak for themselves, so it's always safer. And there was 158,000 records sent to the Trust's off-site storage facility. Next slide, please. Then our phase two of actions, which is what we're still doing now to keep paper light. We're maintaining the culls for pediatric and adult planned admissions and patients on a waiting list to the Bureau from October to the present day. We now have 8,000 health records scanned. We're working with the PPM Plus team to digitize the clinical forms to be used in PPM Plus. We've identified what are the top 20 forms. We have 3 in process at the moment that we're trying to get through and implemented. And then also we're looking at a new electronic document management system. At the moment, they're looking between Cito and Alfresco, and we're hoping to have a decision on that as quickly as possible so that we can move forward. Next slide, please. So the outcome and key achievements, we have closed Clarendon Wing as we showed the photograph. So it's now being used as a scanning preparation facility. Just to show a bit of context, there was 141 bays consisting of 8 shelves per bay which have been removed. We've reduced the records in St. James Library and also removal of racking of 30 bays with 8 shelves per bay. So it's also allowed us to have a lot more room within that library. Reorganised St. James Library to create work areas because, as we say, the roles have had to change. So we've had to got people sitting preparing documents. There's a daily pickup and scan service for the secretaries, and there's a full pickup and scan messenger service established. Next slide, please. So from the success, we're very happy to report that we've been able to purchase 8 industrial scanners, which will enable us to do more in-house scanning in future. We've improved the record availability viewable on PPM+. We support the clinicians in delivering outstanding care. We have a dedicated 24/7 service, and Paperlite was shortlisted for the Efficiency Savings of the Year at the 2020 Health Tech News Awards. So next slide, please. So this is where we're very proud. We've got a total number of images scanned in 2020 is 41.8 million, which I think is an incredible achievement by the team. Next slide, please. And the inpatients record scan, there's over 102,000 patient records which have been picked up and scanned from the wards within this period. So I must say I'm very, very proud of the team. They've done an absolutely magnificent job. Next slide, please. So this just kind of shows you how things have changed. So if you look at February 2020, there were 14,604 requests for health records. In 2021, there was only 813. And then if you look at your scanning images, in February 2020 was 465,000. In 2021 was 826,000. So you can see the complete move of how the library works. It's not really a library anymore, it's all becoming online. Next slide, please. So if we say what actually went well through this process, I think one of the things to highlight is the teamwork. It worked really well as a team, and that really helped it be successful. The team really embraced the change, and they were told to just do it, so they were empowered in the Leeds way to actually move forward and do what they had to do. And also, so trust going paperless proved that it's possible. I think there was a lot of reluctance and people not really happy to embrace this initially. But now it's proven, and now all of a sudden, unfortunately, people think everything is scanned, which is not the case. But we're doing our best to kind of make sure that that does happen, and that's where we're going. We couldn't have done it without the reports from the data warehouse, using the Gateway Bureau for the scanning and the restore support that we got in storing the documents. There were also, I think, what was really important was there were clear and simple processes already in place, which meant it was quick and it was very easy to implement the project. They had already been looking at going paperless for like over 10 years. So the systems and the equipment had already been put in, just not to the extent, but they were able to move really quickly. And I think that the staff in health records, it's been a huge change for them. And, you'll always have some that have embraced it better than others. But I think on the whole, they've done a magnificent job in changing the way that they work and what they have to do. And next slide, please. What would you do differently? I think the only thing that the team have identified was that because this process happened so quickly, and it was literally overnight, so from a Friday afternoon, it was a different way of working. Unfortunately, the communication wasn't as good as it could have been. And I think, you know, for lessons learned, that's what we would do differently. We would make sure that we communicated correctly. Next slide, please. And then just in summary, just to say the project's been extremely successful, but you know, this is just a small part of what still needs to be done, and we need to make sure that we keep the focus and keep everybody, you know, engaged in what we're doing. It needs to be done in a managed way because, you know, it, unfortunately, like everything, it costs money, and we need to make sure that we have the people and the resource in place to do it. We have already started with a questionnaire going out to all the CSUs to try and find out what documents are out there that shouldn't be out there, and what is the best way we can handle that going forward. So I think that brings me to the end of my presentation. I'm not sure if there's any questions.
Great. Thank you so much, Karen. That's fantastic to see. And just before I bring Paul in, just to say I've had the pleasure of visiting the libraries in Brotherton, Clarendon, Gledhow, and just to see and speak with the team and see firsthand the progress that's been made is absolutely phenomenal. It really is. And when you know those photos you showed, I think kind of sum up just the scale of what's been done, and the numbers that you quoted are just incredible as far as what we've been able to do. But this is all happening sort of behind the scenes, but is going to make such a huge difference to the way that care is delivered and how clinicians are able to access information. So this is really great work. So Paul, then Jenny.
Yeah, thanks, Julian, and thanks, Karen. You know, we've spoke. I think this is just a fantastic achievement by that team in the most difficult circumstances and working in some fairly terrible conditions at times. So thank you to you and the team. I was just going to say, kind of going forward, one of the things that we're looking for is we saw those scanning numbers double from February 20 to February 21. What we're hoping is that by February 22, that those have all come down again, because we're digitizing at the point of entry and taking all of the paper out of the system. But obviously we've got a number of steps to go ahead, expanding PPM plus and the like. But the real, you know, number within all of that Karen flagged for me was the number of records now being requested is just tiny compared to what was normal practice a year ago. And so for that transformation to have happened, and I think Karen's been a little harsh on the team to say that kind of communication, you know, was a challenge. It was, but we all remember what it was like in March and April last year. You know, we were just doing what seemed to be the right thing at the right time, and I think the team did do that, and they were empowered, and they did show those leadway values spectacularly well, and they should be applauded for that.
Thank you.
Absolutely, well said, Paul. Jenny.
Karen, that was absolutely brilliant. Gosh, that's a huge undertaking. Paul knows, I think both he and I have come to the conclusion that we're going to need to create and move all of our staff records onto a digital platform as part of the new Hospitals of the Future project.
Yeah.
Have you got any tips?
Choose the right system. That's my one tip. But make sure that you have all your key requirements clear and correct.
Yeah, fabulous. We might be picking your brains a little bit, I think, Karen, if I'm honest.
Yeah. Thanks, Jenny. Tony.
Morning, everyone. Good afternoon, everyone. Karen, is it implicit in the scanning of the documents into a digital library, for want of a better word, is it implicit that going through that process you would repatriate historically missing records, records which had been filed in the wrong place and so on? Will it help to overcome that problem?
Look, there's always going to be human error.
Yeah.
But part of the preparation work that's done when they do scanning is there is checks and balances done to check for that kind of thing. So even when the documents come in from coding, they do a quick check to check if it's the wrong record in place, but we still do find errors. I must be honest, but a lot less.
Thank you.
Thanks very much, Tony. Any other comments or questions? I guess, Karen, I had a question about how you've got the team, motivated and so obviously committed to this, and the kind of approaches you've taken to frame this as an improvement project. What's worked for you in that regard?
I think from a team, it's really been talking to the team, making them aware of the changes. Even now, there is nervousness because they see the library shrinking, and the changes. Some people, it's more difficult for them to do the preparation work, but it's just we've done skills matrices. We're trying to upskill everybody as much as possible. Just clearly talking to them all the time, providing the support that they need. That's really the key to it, is the communication and really supporting them in doing this change. I think that's the way the team have been the most successful.
Yeah.
But you'll always get people who don't embrace change. But sure, we've been lucky that the team we have, the majority have.
Yeah, and that was certainly my sense speaking to them about how they saw the benefits of digitizing the records. And as Paul has said, I think the journey we're on, this is really, really kind of going to just improve so much more the consistency and reliability of our access to information about patients. It's excellent. So I'm just checking if there are any other questions or comments for Karen before we close. Guy, anything you want to add in summary? I think
you're on mute.
Yeah.
That's another pound in the coin tin. I think Karen said it all there, really, Julian. I mean, one thing we do have our eyes on is mopping up sort of pockets of medical records, physical notes that are kept in particular subspecialties around the trust. I don't know, paediatric neurosciences is one example. And just sort of helping them come on the journey with us. I think there's always good reasons why certain subspecialties want to hang on to their paper records. So we're looking forward to working that through with them. But no, it's onwards and upwards. And being part of it.
Terrific. Really good. Karen, I'd encourage you to come back to report out for the next kind of milestone in the project. And we want to really recognise the work. And I know the whole exec team's been around some of the libraries to see this, and we'd want to continue to do that. And I know Paul will ensure that we continue to support this collectively. But please pass on our thanks to the whole team. It really is impressive, and it's inspiring to see. And to have done all this during the pandemic as well has been remarkable. That's been, I think, particularly noteworthy. So tremendous. Thank you very much, Karen.
Thanks so much. We'll pass on your all the thanks.
Great. Well, that's report out for today, which has been excellent. I'd urge you to spread the word about report out. Please join us at the next one, Friday the 19th of March. Same time, same place, everyone. Look forward to seeing you then. And thank you.